Hello everyone, welcome back to another video with me. My name is Deanna and I'm your SD with the bestie. Today it is going to be another knowledge session and it will be on everything about microneedling from start to finish, any contraindications, protocols, serums we use in microneedling, how it works, what it benefits, and my own experience with microneedling. So, what is microneedling? It's a minimal invasive treatment that uses sterile micro needles in a cartridge to create wounds that are controlled to stimulate collagen and elastin production. Because we're creating those micro wounds in our skin, it really triggers our body's natural healing mechanism to produce more collagen and elastin. So what concerns does microneedling help with and how can it help? So the first one is acne scarring, specifically the pitted ones. There's also the pigmentation that comes with scarring from acne or any types of scars. There's also dark spots, pigmentation from sunspots, wrinkles and fine lines, and hydration level, and our pores. So by stimulating collagen production, it really fills in that lost volume from the pitted scars, the wrinkles, the engroovement from the wrinkles and fine lines. It also breaks down the pigment from all the pigmentation, the dark spots, and increase absorption of product when creating those micro injuries. And so essentially what we're using in our serums to help target the concerns, it's better absorbed when we're creating those micro wounds. What you need to know about microneedling. So the first thing is that we always use numbing cream for the comfort of our patients. Because the needles are entering into the skin and possibly going into the dermis layer of our skin, it can really create some discomfort during the treatment. We always want our patients to feel the most comfortable during a treatment, so numbing cream is applied for 30 to 60 minutes depending on the percentage level used in the product. The most wide range in Canada that I know of is our Nun Master, which is 9.6% lidocaine. Benza, which is for more sensitive skin, 5% lidocaine. Our pharmacy compound BLT cream, which is 20% of benzocaine and 4% lidocaine, 2% tetracaine. So this kind of helps subside the discomfort, and again, left on for 30 to 60 minutes, and you can probably feel numb for about 60 minutes up to 3 hours, but most people say it kind of dies down after about 60 minutes. So the second thing is a serum glide for microneedling. So what is that? During microneedling, providers apply a serum to infuse into the skin for more hydration and plumpness, but also the serum is act as a glide for the treatment to feel a little more comfortable and for the skin to prevent any scratches. Majority of the time it is hyaluronic acid, and our body naturally does have hyaluronic acid. It's just to add hydration and plumpness for the lost volume over time as we age. We want to find the most purest form of hyaluronic acid or active ingredient that we are using for the serum glide to prevent granuloma, which is an infection and bacteria transfer in the skin. And this typically happens when a foreign object enters the skin and our body's just not used to it, so it considers it an invader. This is why the purest form of serums is necessary. So there are several types of serums we use, which is hyaluronic acid being one of them, to help hydrate and boost the skin and plumpness and firmness and volume loss. We also have peptides, which helps with the skin texture, the volume, firmness, as well as aiding collagen production for wrinkles and fine lines. We also have ceramide to help retain moisture in the skin, also to help with the skin barrier. We have the growth factor, which is really great for cellular growth and tissue repair. Niacinamide, which is a vitamin B3 to help with anti-inflammatory properties. Really great for my acne skin patients. Okay, as you guys know, we don't gatekeep here. So there's a new one on the market. It's called PDRN. What it stands for is polydeoxyribonucleotide, which is a synthetic DNA derived from salmon DNA. And salmon DNA is 98% identical to human DNA. And this is super popular in Korea. And this is why Koreans have glass-looking skin, and we love it. We are all for it. It helps with the appearance of wrinkles and fine lines. It helps plump up the skin for that volume loss, especially under those dark circles here and under the eyes. So it's great to get that glowing glass skin and that anti-aging glow. So the third thing you want to know is how to prepare yourself for microneedling. As an esthetician, for my first-time patients who has never done a basic facial before, I always recommend them to do a basic facial for that reset of the skin, and then start them off with an initiator starter clinical treatment. This could be dermaplaning, microdermabrasion, it could be a chemical peel. These are all really great starter treatments to build your skin's integrity, the thickness of your skin. And this is going to help build that integrity level to such an invasive treatment. And we want to always start light, because anything bad that goes wrong with microneedling could really scar your skin and damage the skin barrier, essentially, if you are not starting light. So always start with a more starter treatment to build integrity. So the second thing you can do is to add some active ingredients into your home care routine. So in your cleanser or exfoliator, or even a toner or serums to add onto your home care. And this is going to do some light exfoliation and light exposure to active ingredients in order to build integrity at home. This is the 80% maintenance at home to do, while the 20% is done in clinic. And so adding that could really help with your skin's integrity. And then you want to stop the active ingredients 3 to 7 days prior to your treatment, because then it's going to cause photosensitivity and extreme sensitivity, which can lead to damaged sunspots or hyperpigmentation or even scarring because of how sensitive your skin is. It could also lead to a damaged skin barrier. So making sure you stop your actives 3 to 7 days prior can really help prevent this from happening. The last thing is to increase your hyaluronic acid serum. Try to do it more often during the day. It's just to hydrate your skin, and also water intake, so increase that as well. And this can really help with that tightness that you feel after the treatment, also the dryness and flakiness that may possibly happen. So once you're prepping your skin for that hydration and moisture, then you don't really have to worry too much after. But still, you want to add hydration always. Let's move on to contraindications of microneedling. Someone who has rosacea or sensitivity to the skin, who's sunburned or has been exposed to the sun from 3 to 7 days prior to the treatment, we would avoid you just to kind of avoid overall extra sensitivity to your skin. We want to avoid somebody or any active acne on your skin just to prevent any bacteria from transferring all over to the skin. Someone who has uncontrolled diabetes, or on chemotherapy, or has cancer, cardiac health problem, immune compromised, we would also need a doctor's note if you guys were to go ahead with this treatment, just to get the go-ahead that your health is not going to be compromised from this and that you are going to be okay and survive the whole treatment. So doctor's note is always recommended. Anybody who has an active cold sore or infection, we would just avoid you altogether. We want to make sure that it's not spreading the virus all over your skin. You can also get an over-the-counter drug or topical gel from your pharmacy for any cold sores or to prevent any cold sores from appearing. If you do have or have had active cold sores in the past, you already have that virus inside of you, and it's just that it would reappear if you are doing some invasive clinical treatments like this. We would just get you to sign another consent form for this. So not really a contraindication, but if you have an active cold sore or infection, then we would just avoid it, just to prevent any spread. So the last thing I want to tell you guys is post-treatment care. So the aftercare for microneedling. You want to avoid active ingredients for 7 days at least to prevent your skin from any overstimulation or sensitivity in your skin. And to prevent irritation and inflammation in the skin, you want to treat it like it's a damaged, compromised skin barrier. So increase in hyaluronic acid for the hydration level in your skin and locking in and retaining moisture. So ceramides are really great for that. To avoid any clinical treatments for 4 weeks at least. So the bruising and inflammation, redness usually subsides after a week, but you still want to make sure that healing process and collagen production is working. So waiting at least 4 weeks in order to do anything else like chemical peels or any other clinical treatments there is. And of course, being adamant on sunscreen and proactive to reapply. Avoid excess sweating for the first 24 hours. So gym, sauna, hot showers, avoid all of that. Just because it can cause extra irritation and any bacteria infections. So avoiding granuloma again. And avoid the sun for 7 days. And try to wear a hat and bring a hat to your treatment because typically we don't apply sunscreen. We want to use mineral-based makeup if you are going to apply any makeup the next day, but try to avoid it for the first 24 hours at least. Mineral-based sunscreen, just because it acts as a physical barrier as well to external factors, environmental factors, and that dirt and debris. Also, if you are on any blood thinners, we don't want you to bleed to death, so we would definitely just get a doctor's note to see if you can stop the blood thinners for a little bit, and then do the treatment. And then, so I'm going to share my experiences with microneedling. I've had microneedling at least 4 to 5 times now within the past 3 to 4 years, I want to say. So the first 2 times were at school, so me getting microneedling so I can experience firsthand how it feels and what it should feel like for my patients. And I think that's the best way to kind of explain things to people that, you know, I've gotten it done and this is how it feels. And that way you're explaining it from a first point of view, right? And then the second time was actually going in for my friend who was also in school and being her model. So both of those times we used numbing cream, which is the Numb Master. It wasn't my favorite just because I metabolize numbing quicker. And then since then I've did 3 sessions of microneedling at home with my own pharmacy compound, the BLT. So it really helped with comfort for me. So I did at least 40 minutes of that and felt nothing. It literally felt like a finger pressure on my skin. Absolutely love it. I would do it again in a jiffy if I could. But yeah, honestly, I love it. My skin's looking great. So I definitely recommend microneedling for everybody who can get it. And if you're looking to kind of help with your wrinkles and fine lines and to look more youthful for that glass skin, PDRN, guys. PDRN. Anyways, that is all from microneedling. I hope this video was very knowledgeable and educational for all of you. If you guys really liked it, please share it with everybody, and that way they understand this treatment, the ins and outs, at least what happens in my home-based clinic. So if you guys are liking this video, please give it a thumbs up. If you guys want to know more about anything else, comment below what you want to watch next, and subscribe for more. Thank you so much for watching. I'll see you guys in the next one. Bye!